Question 1. The audit findings indicate that a certified clinical trauma specialist, CCTS, has been consistently referring clients from a specific cultural group to traditional healers for trauma-related distress, without conducting a thorough assessment of the client's understanding of these practices or their potential impact on conventional therapeutic progress. The audit team is concerned about the ethical implications of this approach. Which of the following actions by the CCTS best addresses the audit findings while upholding ethical standards? Option A. Immediately cease all referrals to traditional healers and inform the clients that only evidence-based Western therapeutic modalities will be utilized, as these are the only ethically sound approaches for trauma treatment. Option B. Continue referring clients to traditional healers as requested, assuming that these practices are inherently beneficial and culturally appropriate, and document these referrals without further inquiry into their specific nature or impact on the client's overall treatment plan. Option C. Engage in a collaborative discussion with the client to understand their beliefs about traditional healing, explore how these practices align with their understanding of trauma and recovery, and jointly determine how to integrate or coordinate these practices with evidence-based trauma treatment, ensuring client safety and therapeutic efficacy. Option D. Advise clients that traditional healing practices are not recognized by the CCTS certification and therefore cannot be incorporated into their treatment, suggesting they seek these practices independently of their trauma therapy. The correct answer is C. Engage in a collaborative discussion with the client to understand their beliefs about traditional healing, explore how these practices align with their understanding of trauma and recovery, and jointly determine how to integrate or coordinate these practices with evidence-based trauma treatment, ensuring client safety and therapeutic efficacy. Explanation. This scenario presents a professional challenge rooted in the intersection of cultural competence and ethical practice within the CCTS framework. The core difficulty lies in balancing the client's expressed cultural needs with the clinician's ethical obligations to provide evidence-based and safe care, while navigating potential misunderstandings arising from cultural differences in communication and help-seeking behaviors. Careful judgment is required to avoid imposing one's own cultural lens or dismissing the client's deeply held beliefs and practices. The correct approach represents best professional practice because it prioritizes a collaborative and culturally sensitive exploration of the client's concerns. It acknowledges the client's cultural framework as a valid starting point for understanding their trauma experience and treatment preferences. This aligns with CCTS ethical guidelines that emphasize respecting client autonomy, promoting cultural humility, and engaging in culturally responsive interventions. By seeking to understand the client's perspective within their cultural context, the clinician builds trust and rapport, which are foundational for effective trauma treatment. This approach avoids making assumptions and instead fosters an environment where the client feels heard and validated, leading to a more personalized and effective treatment plan. An incorrect approach that involves immediately dismissing the client's cultural explanation and insisting on a westernized therapeutic model fails to acknowledge the client's lived experience and cultural identity. This is an ethical failure as it violates the principle of client autonomy and respect for diversity. It can be perceived as ethnocentric and may lead to alienation, mistrust, and premature termination of therapy. Furthermore, it demonstrates a lack of cultural humility, a core tenet of ethical trauma-informed care. Another incorrect approach that involves agreeing to incorporate practices without fully understanding their implications or potential risks, solely to appease the client, is also ethically problematic. While cultural sensitivity is crucial, it does not supersede the clinician's responsibility to ensure client safety and provide effective, evidence-informed care. This approach risks providing ineffective or even harmful interventions if the cultural practices are not compatible with trauma recovery principles, or if they are implemented without proper understanding of their meaning and application within the client's culture. This can lead to a failure to address the underlying trauma effectively and potentially exacerbate distress. A professional decision-making process for similar situations should involve a continuous cycle of self-reflection, cultural inquiry, and collaborative problem-solving. Professionals should first engage in self-assessment to identify their own cultural biases and assumptions. Then, they should actively seek to understand the client's cultural background, beliefs, and values through open-ended questions and active listening, demonstrating cultural humility. This understanding should then inform a collaborative discussion about treatment goals and interventions, ensuring that the client's cultural preferences are considered alongside evidence-based practices. The ultimate goal is to integrate cultural considerations into a therapeutic approach that is both effective and respectful of the client's unique identity and experiences. Question 2. Assessment of trauma symptomatology in a 7-year-old child who witnessed a violent crime and an adult survivor of domestic violence requires a nuanced approach. Which of the following assessment strategies best reflects best professional practice for differentiating and understanding their respective trauma responses? Option A. Applying a universal trauma symptom model that assumes identical manifestations of trauma across all age groups and cultural backgrounds. Option B. Utilizing standardized adult trauma symptom checklists for both the child and the adult to ensure consistent diagnostic criteria are applied. Option C. Employing age-appropriate observational techniques and caregiver interviews for the child, alongside a direct verbal assessment of intrusive thoughts, avoidance, and hyperarousal for the adult, while considering cultural influences on symptom expression for both. Option D. Focusing solely on observable behavioral changes in the child, and relying on the adult's self-report of emotional distress without considering developmental or cultural factors. The correct answer is C. Employing age-appropriate observational techniques and caregiver interviews for the child, alongside a direct verbal assessment of intrusive thoughts, avoidance, and hyperarousal for the adult, while considering cultural influences on symptom expression for both. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the Certified Clinical Trauma Specialist, CCTS, to differentiate between trauma symptomatology that may present similarly across different age groups but manifest with distinct nuances. The core challenge lies in avoiding a one-size-fits-all approach and instead employing a developmentally and culturally sensitive lens. Failure to do so can lead to misdiagnosis, ineffective treatment, and potential re-traumatization. The CCTS must navigate the complexities of how trauma impacts cognitive, emotional, and behavioral functioning differently in a child versus an adult, while also considering potential cultural interpretations of distress. Correct approach analysis. The correct approach involves utilizing a comprehensive assessment that explicitly considers developmental stages and cultural context. For a child, this would include observing play behaviors, interviewing caregivers, and using age-appropriate assessment tools that capture somatic complaints, behavioral changes, e.g., regression, aggression, and cognitive distortions that might not be verbally articulated. For an adult, the assessment would focus on direct verbal reporting of intrusive thoughts, avoidance behaviors, negative alterations in cognitions and mood, and hyperarousal, while remaining mindful of cultural idioms of distress and potential stigma. This approach aligns with best professional practice by adhering to ethical principles of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm, by ensuring accurate understanding and tailored interventions. It also implicitly follows CCTS guidelines that emphasize a holistic and individualized approach to trauma assessment. Incorrect approaches analysis. An approach that solely relies on standardized adult diagnostic criteria without adaptation for a child is ethically flawed. This fails to acknowledge that children may not possess the cognitive or verbal capacity to articulate their experiences in the same way as adults, leading to underestimation or misinterpretation of their trauma symptoms. This could violate the principle of non-maleficence by providing an inadequate or inappropriate assessment. Another incorrect approach would be to apply a single cultural framework to all clients, regardless of their background. Trauma expression and interpretation are heavily influenced by cultural norms, beliefs, and experiences. Ignoring this can lead to misinterpreting culturally normative behaviors as pathology or failing to recognize culturally specific manifestations of trauma. This is an ethical failure, as it demonstrates a lack of cultural humility and competence, potentially causing harm and undermining the therapeutic alliance. A third incorrect approach would be to prioritize symptom checklists over a thorough clinical interview and observation. While checklists can be useful screening tools, they are insufficient for capturing the full spectrum of trauma symptomatology, especially across diverse populations. Trauma is a complex phenomenon that requires nuanced understanding gained through direct interaction and careful observation of nonverbal cues, which a checklist cannot provide. This approach risks superficiality and can lead to an incomplete or inaccurate assessment, failing to meet the standard of care expected of a CCTS. Professional reasoning. Professionals should approach trauma assessment with a framework that prioritizes client-centeredness, cultural humility, and developmental appropriateness. This involves 1. Actively seeking to understand the client's unique experience of trauma, including their developmental stage and cultural background. 2. Employing a range of assessment methods, including clinical interviews, behavioral observations, and validated, culturally sensitive tools. 3. Continuously evaluating and adapting the assessment process based on the client's responses and presentation. 4. Consulting with supervisors or peers when faced with complex cases or uncertainty regarding cultural interpretations or developmental considerations. This iterative and flexible approach ensures that the assessment is both accurate and ethically sound, laying the foundation for effective trauma-informed care. Question 3. Comparative studies suggest that early attachment experiences significantly influence an individual's capacity to process trauma. A certified clinical trauma specialist, CCTS, is working with a client who presents with symptoms of complex trauma, including difficulties with emotional regulation and interpersonal relationships, stemming from early childhood neglect and subsequent adult traumatic experiences. Considering the profound impact of attachment on trauma processing, which of the following therapeutic approaches best aligns with CCTS recommended best practices for this client? Option A. Utilize a purely cognitive behavioral approach to reframe negative thought patterns related to self-worth, without acknowledging or integrating the impact of attachment disruptions or traumatic experiences. Option B. Focus exclusively on exploring the client's attachment history and patterns, interpreting all current symptoms through the lens of insecure attachment, without directly addressing the traumatic events. Option C. Immediately initiate detailed exploration of all traumatic memories to facilitate catharsis and release, assuming that confronting the past directly will resolve current attachment-related difficulties. Option D. Prioritize building a secure therapeutic alliance, focusing on psychoeducation about trauma and attachment, developing coping skills for emotional regulation and distress tolerance, and gradually introducing trauma processing when the client demonstrates readiness and stability. The correct answer is D. Prioritize building a secure therapeutic alliance, focusing on psychoeducation about trauma and attachment, developing coping skills for emotional regulation and distress tolerance, and gradually introducing trauma processing when the client demonstrates readiness and stability. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent complexity of addressing trauma within the context of attachment disruptions. Clinicians must navigate the delicate balance between acknowledging the impact of early relational experiences on trauma processing and avoiding pathologizing or oversimplifying the client's current presentation. The challenge lies in integrating theoretical understanding of attachment with practical, client-centered interventions, ensuring that the therapeutic approach is sensitive to the client's unique history and current needs, while remaining within the ethical and regulatory boundaries of trauma-informed care as defined by CCTS standards. Correct approach analysis. The correct approach emphasizes a phased, trauma-informed intervention that prioritizes safety and stabilization before directly processing traumatic memories. This aligns with CCTS guidelines that advocate for a gradual approach to trauma work, recognizing that individuals with insecure or disorganized attachment patterns may be particularly vulnerable to re-traumatization. By focusing on building a secure therapeutic alliance, developing coping mechanisms, and fostering emotional regulation, the clinician creates a foundation of safety and trust. This allows for the eventual exploration of traumatic material in a controlled and supportive manner, minimizing the risk of destabilization and promoting healing. This approach is ethically sound as it upholds the principle of do no harm and is consistent with best practices in trauma treatment. Incorrect approaches analysis. One incorrect approach involves immediately delving into the details of traumatic experiences without adequate preparation. This fails to acknowledge the heightened risk of re-traumatization for individuals with attachment difficulties, potentially overwhelming the client and damaging the therapeutic alliance. Ethically, this could be seen as a failure to adequately assess risk and implement appropriate safety measures, violating the principle of beneficence and non-maleficence. Another incorrect approach is to solely focus on attachment patterns without directly addressing the trauma. While attachment is a crucial lens, neglecting the explicit trauma narrative can leave the client feeling unheard or invalidated regarding their traumatic experiences. This approach risks oversimplifying the client's distress and may not lead to resolution of the trauma symptoms, potentially violating the duty to provide comprehensive care. A third incorrect approach is to dismiss the client's trauma symptoms as solely a result of attachment issues, thereby minimizing the impact of the traumatic events themselves. This can lead to a lack of appropriate trauma-specific interventions and can be invalidating to the client's lived experience of trauma. This approach fails to meet the standard of care for trauma treatment and could be considered ethically negligent. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough assessment of the client's safety, stabilization needs, and attachment history. This assessment informs the development of a phased treatment plan that prioritizes building a secure therapeutic relationship and developing coping skills before engaging in direct trauma processing. Continuous monitoring of the client's response to interventions and flexibility in adapting the treatment plan are essential. Adherence to CCTS ethical guidelines and best practices in trauma-informed care ensures that interventions are both effective and ethically sound, prioritizing the client's well-being and minimizing the risk of harm. Question 4. System analysis indicates that a certified clinical trauma specialist is working with a client who has a history of complex trauma, including experiences of institutional abuse and a deep distrust of authority figures. The client is currently experiencing heightened distress and has expressed vague concerns about their safety without specifying immediate threats. The clinician needs to develop a safety plan. Which of the following approaches best reflects best practice in risk assessment and safety planning for this client? Option A. Immediately implement a comprehensive safety plan based on the clinician's professional judgment of potential risks, focusing on external controls and reporting mechanism to ensure the client's immediate safety, given their history. Option B. Focus the safety planning discussion solely on the client's internal coping mechanisms, assuming that external interventions might trigger their distrust and re-traumatize them, and avoid discussing any potential reporting requirements. Option C. Present the client with a standardized safety plan template and guide them through filling it out, ensuring all potential risks are covered according to established clinical protocols, regardless of the client's specific comfort level with certain interventions. Option D. Collaboratively identify the client's perceived risks, develop a personalized safety plan that incorporates their coping strategies and support networks, and empower them to take the lead in implementing the plan, while also discussing potential external supports if needed. The correct answer is D. Collaboratively identify the client's perceived risks, develop a personalized safety plan that incorporates their coping strategies and support networks, and empower them to take the lead in implementing the plan, while also discussing potential external supports if needed. Explanation. Scenario analysis. This scenario presents a common yet complex challenge in trauma-informed care, balancing a client's expressed desire for autonomy with the clinician's ethical and professional responsibility to ensure safety. The client's history of trauma, particularly involving perceived betrayal by authority figures, makes them highly sensitive to any intervention that might feel controlling or invalidating. This necessitates a delicate approach that prioritizes collaboration and empowerment, while still addressing potential risks. The challenge lies in accurately assessing the level of risk without triggering further distress or resistance, and developing a safety plan that is both effective and client-centered. Correct approach analysis. The correct approach emphasizes a collaborative and client-led safety planning process. This aligns with best practices in trauma-informed care, which advocate for empowering clients and respecting their lived experiences. By actively involving the client in identifying their triggers, coping mechanisms, and support systems, the clinician fosters a sense of agency and ownership over their safety. This approach is ethically grounded in principles of autonomy and beneficence, ensuring that interventions are tailored to the individual's needs and preferences while still aiming to promote well-being. Regulatory frameworks for trauma specialists often mandate a client-centered approach that respects self-determination, making this method the most professionally sound. Incorrect approaches analysis. An approach that solely relies on the clinician's judgment without significant client input risks alienating the client and creating a safety plan that is perceived as imposed. This violates the ethical principle of autonomy and can be counterproductive, as a client who feels unheard or controlled is less likely to adhere to a safety plan. From a regulatory standpoint, such an approach could be seen as paternalistic and failing to meet the standards of client-centered care, potentially leading to ethical complaints or professional sanctions. Another incorrect approach would be to dismiss the client's concerns about specific safety measures due to their past trauma experiences. This invalidates their trauma narrative and can re-traumatize them, eroding trust and hindering the therapeutic alliance. Ethically, this demonstrates a lack of cultural humility and an insufficient understanding of trauma's impact on perception and behavior. It fails to acknowledge the client's unique vulnerabilities and the importance of tailoring interventions to their specific trauma history. Finally, an approach that focuses exclusively on external controls or reporting mechanisms without addressing the client's internal coping strategies and support networks would be incomplete. While external safety measures can be important, a robust safety plan must also equip the client with the skills and resources to manage distress and ensure their safety independently. Failing to do so neglects the principle of fostering resilience and self-efficacy, which are crucial components of trauma recovery. Professional reasoning. Professionals should approach risk assessment and safety planning with a trauma-informed lens, prioritizing a collaborative and empowering process. This involves active listening, validating the client's experiences, and co-creating solutions. The decision-making process should involve 1. Thoroughly assessing the client's current situation, including their perceived risks and strengths. 2. Exploring potential safety strategies with the client, considering their preferences and past experiences. 3. Collaboratively developing a safety plan that is realistic, actionable, and respects their autonomy. And 4. Regularly reviewing and revising the plan as the client's needs evolve. This iterative process ensures that the safety plan remains relevant and effective, fostering a strong therapeutic alliance built on trust and mutual respect. Question 5. To address the challenge of a certified clinical trauma specialist, CCTS, who discovers a close familial relationship with a new client seeking eye movement desensitization and reprocessing EMDR therapy, what is the most ethically sound and professionally responsible course of action to ensure the client's safety and the integrity of the therapeutic process? Option A. Inform the client about the familial connection but proceed with EMDR therapy, emphasizing the CCTS ability to remain objective due to their professional training. Option B. Immediately consult with a qualified supervisor or an ethics committee to discuss the dual relationship and collaboratively determine the most appropriate course of action, which may include referral or modified treatment with full disclosure and consent. Option C. Terminate EMDR therapy immediately and refer the client to a therapist with whom the CCTS has a pre-existing personal friendship, believing this will ensure a comfortable transition. Option D. Proceed with EMDR therapy as planned, assuming the familial connection will not impact clinical judgment, and focus solely on the client's trauma symptoms. The correct answer is B. Immediately consult with a qualified supervisor or an ethics committee to discuss the dual relationship and collaboratively determine the most appropriate course of action, which may include referral or modified treatment with full disclosure and consent. Explanation. This scenario presents a professional challenge due to the inherent power imbalance in the therapeutic relationship and the potential for dual relationships to compromise clinical judgment and client welfare. The therapist's personal connection to the client's family introduces a significant ethical consideration that requires careful navigation to uphold professional boundaries and ensure the client's best interests remain paramount. The core of the challenge lies in balancing the therapist's desire to help a familiar individual with the ethical imperative to avoid conflicts of interest and maintain objectivity in treatment. The correct approach represents best professional practice because it prioritizes the client's well-being and adheres to the ethical guidelines of the Certified Clinical Trauma Specialist (CCTS) framework, which emphasizes avoiding dual relationships that could impair professional judgment or exploit the client. Seeking consultation from a qualified supervisor or an ethics committee allows for an objective assessment of the situation, exploration of potential risks, and development of a plan that safeguards the therapeutic process. This collaborative approach ensures that the decision made is informed, ethical, and aligned with professional standards, ultimately protecting the client from potential harm and maintaining the integrity of the therapeutic relationship. An incorrect approach that involves proceeding with EMDR therapy without disclosing the familial connection and obtaining informed consent is a significant ethical failure. This violates the principle of transparency and informed consent, as the client has a right to know about potential biases or conflicts of interest that could affect their treatment. It also breaches the ethical standard against engaging in dual relationships that could exploit the client or impair professional judgment. Another incorrect approach, which is to terminate EMDR therapy abruptly and refer the client to a therapist with whom the therapist has a pre-existing personal relationship, is also ethically problematic. While referral is often appropriate, doing so without a thorough assessment of the client's needs and ensuring a smooth transition to a new provider can be detrimental to the client's progress. Furthermore, the choice of referral should be based on the new therapist's qualifications and suitability for the client's specific trauma, not on the existing personal relationship between the referring therapist and the potential new therapist, which could also create an inappropriate dual relationship. The professional decision-making process for similar situations should involve a systematic evaluation of ethical principles, professional standards, and potential risks. This includes identifying any potential conflicts of interest, assessing the impact of dual relationships on the therapeutic alliance, and prioritizing the client's autonomy and well-being. Seeking supervision or consultation is a crucial step in this process, providing an opportunity to discuss the ethical dilemma with experienced professionals and gain diverse perspectives. Documenting all consultations and decisions made is also essential for accountability and professional reflection. Question 6. Compliance review shows that a certified clinical trauma specialist is working with a client who recently experienced a significant job loss. The client reports feeling overwhelmed, tearful, and having difficulty concentrating at work, which began shortly after the job loss. The client also expresses increased irritability with family members and has had trouble sleeping. The specialist is considering the diagnosis of an adjustment disorder. Which of the following diagnostic considerations is most critical for accurately assessing this client for an adjustment disorder, according to CCTS-aligned diagnostic frameworks? Option A. Focusing solely on the intensity of the client's emotional distress without considering the specific stressor or functional impact. Option B. Assessing the client's pre-existing personality traits and coping mechanism to predict their long-term resilience. Option C. Determining if the client's symptoms are a direct and significant response to the stressor of job loss and are causing clinically significant impairment in social or occupational functioning. Option D. Ruling out the presence of a major depressive episode or generalized anxiety disorder based on symptom severity alone. The correct answer is C. Determining if the client's symptoms are a direct and significant response to the stressor of job loss and are causing clinically significant impairment in social or occupational functioning. Explanation. Scenario analysis. This scenario presents a professional challenge due to the nuanced presentation of adjustment disorder symptoms, which can overlap with other mental health conditions and normal stress responses. Differentiating between a transient stress reaction and a diagnosable adjustment disorder requires careful clinical assessment, adherence to diagnostic criteria, and consideration of the client's functional impairment. The professional must balance providing timely support with ensuring accurate diagnosis and appropriate intervention, all within the ethical and regulatory framework governing clinical practice. Correct approach analysis. The correct approach involves a thorough assessment that considers the onset, duration, and severity of symptoms in relation to a specific stressor. It requires evaluating the degree of functional impairment in social, occupational, or academic areas, as well as the absence of criteria for another mental disorder. This aligns with the diagnostic principles of the DSM-5TR, or Relevant Diagnostic Manual specified by CCTS, and ethical guidelines that mandate accurate diagnosis and evidence-based treatment. The focus on the client's subjective distress and objective impairment, directly linked to the stressor, is crucial for a valid adjustment disorder diagnosis. Incorrect approaches analysis. One incorrect approach might involve immediately diagnosing the client with a more severe condition without fully exploring the stressor's impact and the specific symptom presentation. This could lead to misdiagnosis, inappropriate treatment, and potential harm to the client by overlooking the underlying adjustment issue or by over-medicalizing a normal stress response. This violates the ethical principle of beneficence and non-maleficence, as well as regulatory requirements for accurate diagnostic practice. Another incorrect approach could be to dismiss the client's distress as a normal reaction to stress without adequate assessment of functional impairment. While some stress responses are normative, failing to identify a diagnosable adjustment disorder when present can result in a lack of necessary support and intervention, potentially prolonging the client's suffering and hindering their recovery. This neglects the professional's responsibility to assess for and treat mental health conditions. A third incorrect approach might involve applying a standardized treatment protocol without a comprehensive diagnostic evaluation. This bypasses the critical step of confirming the diagnosis of adjustment disorder, potentially leading to ineffective or even detrimental interventions if the underlying issue is different. It fails to meet the regulatory expectation of individualized care based on accurate assessment. Professional reasoning. Professionals should approach such situations by first establishing rapport and conducting a comprehensive biopsychosocial assessment. This includes exploring the nature of the stressor, the client's response, emotional, cognitive, behavioral, the timeline of symptoms, and the impact on daily functioning. They should then consult relevant diagnostic criteria, e.g., DSM-5TR, and ethical codes to guide their diagnostic formulation. If an adjustment disorder is suspected, they must differentiate it from other conditions and ensure the criteria for functional impairment are met. Treatment planning should then be tailored to the specific diagnosis and the client's needs, with ongoing reassessment. Question 7. Strategic planning requires a certified clinical trauma specialist, CCTS, to consider the neurobiological effects of trauma when developing a treatment plan. A client who has experienced significant interpersonal trauma expresses a strong desire to engage in a specific type of somatic therapy that they have read about, believing it will directly address their physical manifestations of anxiety. The CCTS understands that while somatic therapies can be beneficial, the client's specific neurobiological profile, characterized by heightened amygdala reactivity and impaired prefrontal cortex regulation, might necessitate a phased approach that first focuses on stabilization and emotional regulation before directly targeting deep somatic release. What is the most ethically and clinically sound approach for the CCTS? Option A. Refer the client to another therapist who specializes in the requested somatic therapy, without further discussion or exploration of alternative approaches that might integrate the client's preferences with the CCTS neurobiological understanding. Option B. Collaboratively explore the client's interest in the somatic therapy, educate them on the neurobiological underpinnings of their symptoms, and discuss how a phased approach, potentially incorporating elements of their desired therapy alongside other evidence-based interventions, can best address their specific neurobiological profile for sustained recovery. Option C. Gently decline the client's request for the specific somatic therapy, explaining that it is not aligned with their neurobiological profile, and proceed with a treatment plan solely based on the clinician's assessment of their neurobiological needs. Option D. Immediately implement the somatic therapy the client requested, as client preference is paramount in trauma treatment, regardless of the clinician's assessment of neurobiological needs. The correct answer is B. Collaboratively explore the client's interest in the somatic therapy, educate them on the neurobiological underpinnings of their symptoms, and discuss how a phased approach, potentially incorporating elements of their desired therapy alongside other evidence-based interventions, can best address their specific neurobiological profile for sustained recovery. Explanation. This scenario presents a professional challenge due to the inherent complexity of trauma's neurobiological impact and the ethical imperative to provide evidence-based, client-centered care. The Certified Clinical Trauma Specialist, CCTS, must navigate the tension between a client's expressed desire for a specific intervention and the clinician's understanding of the neurobiological underpinnings of trauma recovery, ensuring that interventions are not only desired, but also therapeutically sound and ethically responsible. Careful judgment is required to balance client autonomy with professional expertise and the ethical duty to avoid harm. The correct approach represents best professional practice because it prioritizes a thorough assessment of the client's neurobiological responses to trauma and integrates this understanding into a collaboratively developed treatment plan. This aligns with ethical guidelines that mandate competence, informed consent, and the use of evidence-based practices. By considering the neurobiological effects, the clinician can tailor interventions to address the specific ways trauma has impacted the client's brain and nervous system, such as dysregulation in the amygdala, hippocampus, or prefrontal cortex, thereby enhancing the likelihood of effective and lasting recovery. This approach respects the client's agency while ensuring the intervention is grounded in scientific understanding and ethical principles of beneficence and non-maleficence. An incorrect approach that focuses solely on the client's stated preference without considering the neurobiological implications fails to uphold the ethical duty of competence. It risks offering an intervention that may be ineffective or even detrimental if it does not address the underlying neurobiological dysregulation caused by trauma. This could lead to client frustration, a lack of progress, and a breach of the professional's responsibility to provide appropriate care. Another incorrect approach that dismisses the client's expressed desire outright, without a thorough explanation or exploration of alternatives, can be ethically problematic. It may undermine client autonomy and the therapeutic alliance, potentially leading to disengagement from treatment. While the clinician's expertise is crucial, it must be applied in a way that respects the client's voice and fosters collaboration. A professional decision-making process for similar situations should involve a systematic approach. 1. Comprehensive assessment. Conduct a thorough assessment that includes understanding the client's trauma history, current symptoms, and their perceived impact, with a specific focus on identifying potential neurobiological correlates of their distress. 2. Evidence-based practice integration. Review current research and best practices regarding the neurobiological effects of trauma and effective interventions for those specific effects. 3. Collaborative treatment planning. Engage the client in a dialogue about assessment findings and evidence-based options. Explain the rationale behind recommended interventions, including how they address the neurobiological aspects of their trauma. 4. Client autonomy and informed consent. Ensure the client fully understands the proposed treatment, its potential benefits, risks, and alternatives, and provides informed consent. 5. Ethical consultation. If uncertainty exists regarding the best course of action, consult with supervisors or ethics committees. Question 8. The risk matrix shows a client presenting with intrusive memories, avoidance of trauma-related stimuli, negative alterations in cognitions and mood, and hyperarousal. However, the client also reports significant interpersonal difficulties, a pervasive sense of emptiness, and unstable self-image that predates the traumatic event. Which of the following approaches best guides the differential diagnosis process in this complex presentation? Option A. Conduct a comprehensive diagnostic assessment that systematically evaluates for PTSD, other trauma and stress-related disorders, and potential co-occurring conditions such as borderline personality disorder, given the reported pre-existing symptoms. Option B. Focus solely on the intrusive memories and hyperarousal symptoms, as these are the most direct indicators of trauma response, and defer evaluation of other symptoms until the trauma-related issues are stabilized. Option C. Assume the interpersonal difficulties and unstable self-image are dissociative phenomena directly stemming from the trauma, and proceed with trauma-focused interventions exclusively. Option D. Prioritize a diagnosis of post-traumatic stress disorder, PTSD, and address the interpersonal and self-image issues as secondary consequences of the trauma. Correct answer is D. Prioritize a diagnosis of post-traumatic stress disorder, PTSD, and address the interpersonal and self-image issues as secondary consequences of the trauma. Explanation. This scenario is professionally challenging due to the overlapping symptomology between trauma-related disorders and other mental health conditions, particularly those involving anxiety, mood disturbances, and personality traits. A trauma-informed approach requires careful differentiation to ensure accurate diagnosis and effective treatment planning, avoiding misattribution of symptoms or the initiation of inappropriate interventions. The Certified Clinical Trauma Specialist, CCTS, designation implies a commitment to evidence-based practices and ethical standards in trauma care. The correct approach represents best professional practice because it prioritizes a comprehensive, multifaceted assessment that considers the client's history, current presentation, and potential co-occurring conditions. This aligns with the ethical imperative to provide competent and individualized care, as outlined in professional codes of conduct for mental health professionals. Specifically, it emphasizes the use of validated assessment tools, thorough clinical interviewing, and consultation when necessary, all of which are foundational to accurate differential diagnosis and adherence to best practice guidelines in trauma treatment. This approach respects the client's experience and avoids premature conclusions, ensuring that treatment is tailored to their unique needs and diagnostic profile. An incorrect approach that relies solely on a single diagnostic criterion or a superficial understanding of trauma symptoms would represent a significant ethical and professional failure. For instance, attributing all dissociative experiences solely to post-traumatic stress disorder, PTSD, without considering dissociative disorders or other conditions would be a diagnostic error. This could lead to ineffective treatment and potentially exacerbate the client's distress. Similarly, overlooking the possibility of a co-occurring mood disorder, such as major depressive disorder, and treating only trauma-related symptoms would fail to address the full spectrum of the client's difficulties, violating the principle of comprehensive care. Another failure would be to dismiss symptoms that do not fit a classic trauma narrative, thereby invalidating the client's experience and potentially missing critical diagnostic information. These approaches lack the rigor required for differential diagnosis and can lead to misdiagnosis, inappropriate treatment, and harm to the client. Professionals should employ a systematic decision-making process that begins with a broad differential diagnosis, considering all plausible conditions that could explain the client's symptoms. This involves gathering detailed history, conducting a thorough mental status examination, and utilizing appropriate diagnostic instruments. The process should involve hypothesis testing, where initial diagnostic impressions are refined or revised based on emerging information. Consultation with supervisors or peers, particularly when dealing with complex cases or diagnostic uncertainty, is a crucial component of ethical practice and ensures that the highest standard of care is maintained. Question 9. Consider a scenario where a certified clinical trauma specialist, CCTS, is working with a client who reports experiencing significant anxiety, intrusive thoughts, and avoidance behaviors following a recent stressful life event. The client describes feeling overwhelmed and having difficulty concentrating at work. The CCTS notes that the client's symptoms are distressing and impacting their daily functioning. When exploring the client's history, the CCTS learns that while the client has experienced some challenging life events, they do not report a history of direct exposure to life-threatening situations or severe violence. However, the client's partner recently experienced a traumatic event, and the client has been providing extensive support. Which of the following diagnostic considerations best reflects a thorough and ethically sound approach for the CCTS? Option A. Immediately conclude that the symptoms are not trauma-related due to the lack of direct personal exposure to a life-threatening event and focus solely on general stress management techniques. Option B. Prioritize a diagnosis of acute stress disorder or post-traumatic stress disorder, considering the client's current distress and the impact on functioning, while acknowledging the indirect nature of their exposure. Option C. Consider the possibility of vicarious traumatization or secondary traumatic stress, alongside a differential diagnosis of other anxiety-related disorders, given the client's role as a supporter to someone who experienced trauma. Option D. Focus exclusively on ruling out other common anxiety disorders, such as generalized anxiety disorder or panic disorder, given the absence of direct personal exposure to a life-threatening event. The correct answer is B. Prioritize a diagnosis of acute stress disorder or post-traumatic stress disorder, considering the client's current distress and the impact on functioning, while acknowledging the indirect nature of their exposure. Explanation. This scenario presents a professional challenge due to the inherent complexity of diagnosing and treating trauma-related disorders, particularly when a client's presentation is nuanced and potentially overlaps with other conditions. The Certified Clinical Trauma Specialist, CCTS, must navigate the diagnostic criteria carefully, considering the client's subjective experience alongside objective behavioral indicators. The professional challenge lies in distinguishing between a primary trauma-related disorder and symptoms that may be secondary to other stressors or pre-existing conditions, while always prioritizing the client's well-being and safety. The correct approach represents best professional practice because it emphasizes a comprehensive, client-centered assessment that integrates multiple sources of information. This includes a thorough trauma history, exploration of current symptoms, and consideration of the client's functional impairment. Adhering to established diagnostic guidelines, such as those found in the DSM-5TR, is paramount for accurate diagnosis and effective treatment planning. This approach respects the client's narrative while grounding interventions in evidence-based practice, ensuring that treatment is tailored to the specific needs arising from trauma exposure. It also aligns with ethical principles of beneficence and non-maleficence by seeking to provide the most appropriate and least harmful care. An incorrect approach that relies solely on a single symptom or a superficial understanding of trauma would be professionally unacceptable. For instance, prematurely labeling a client's distress as solely a trauma-related disorder without a thorough differential diagnosis could lead to misdirected treatment, potentially exacerbating symptoms or failing to address underlying issues. This would violate the ethical principle of competence, as it suggests a lack of thorough assessment. Another incorrect approach might involve dismissing the client's subjective experience in favor of purely observable behaviors, which disregards the subjective nature of trauma and its impact, thereby failing to build therapeutic rapport and potentially invalidating the client's lived experience. This could also be seen as a failure to adhere to ethical guidelines regarding client-centered care. The professional decision-making process for similar situations should involve a systematic approach. 1. Begin with active listening and empathetic engagement to build rapport and gather the client's narrative. 2. Conduct a comprehensive biopsychosocial assessment, paying close attention to trauma history, current stressors, and symptom presentation. 3. Utilize standardized diagnostic criteria, e.g., DSM-5TR, as a framework for evaluation, but remain flexible and consider the client's unique context. 4. Engage in differential diagnosis to rule out or identify co-occurring conditions. 5. Collaborate with the client in developing a treatment plan that is evidence-based, client-centered, and addresses their specific goals and needs. 6. Continuously monitor treatment progress and adjust the plan as necessary, always prioritizing the client's safety and well-being. Question 10. The investigation demonstrates that a client presents with a history of significant trauma and is exhibiting symptoms that suggest potential post-traumatic stress disorder. The clinician is considering various assessment approaches to understand the client's current functioning and inform treatment. Which of the following approaches best aligns with the principles of standardized trauma assessment and ethical practice for a certified clinical trauma specialist? Option A. Employing an older, less commonly used assessment tool that the clinician has used in the past, even if its psychometric properties are not well established for current clinical use. Option B. Administering the PTSD checklist for DSM-5, PCL-5, to assess the severity and nature of PTSD symptoms, while also considering the client's cultural background and potential for co-occurring conditions. Option C. Focusing solely on the client's current mood and anxiety symptoms without directly inquiring about the trauma history or its impact. Option D. Utilizing a general mental health screening questionnaire that covers a broad range of psychological issues but does not specifically target trauma-related symptoms. The correct answer is B. Administering the PTSD checklist for DSM-5, PCL-5, to assess the severity and nature of PTSD symptoms, while also considering the client's cultural background and potential for co-occurring conditions. Explanation. This scenario presents a professional challenge due to the inherent variability in how individuals respond to trauma and the potential for misinterpretation of assessment data. Careful judgment is required to ensure that the chosen assessment instrument is appropriate for the client's presentation and that the results are integrated ethically and effectively into the treatment plan. The CCTS framework emphasizes evidence-based practice and client-centered care, necessitating the use of validated tools and a nuanced understanding of their limitations. The correct approach represents best professional practice because it prioritizes the use of a standardized, validated instrument, PCL-5, that is specifically designed to assess the severity and nature of PTSD symptoms, which is directly relevant to the client's reported trauma history. This aligns with CCTS ethical guidelines that mandate the use of appropriate and evidence-based assessment tools to ensure accurate diagnosis and effective treatment planning. The clinician's consideration of the client's cultural background and potential for co-occurring conditions demonstrates a commitment to a holistic and culturally sensitive approach, further reinforcing best practice. An incorrect approach that relies solely on a general screening tool without further specific assessment for trauma sequelae fails to meet the professional standard for trauma assessment. This could lead to an incomplete understanding of the client's needs and potentially inappropriate treatment interventions, violating the ethical obligation to provide competent care. Another incorrect approach that focuses on non-trauma-specific symptoms without acknowledging the central role of the trauma history in the client's presentation overlooks the core principles of trauma-informed care. This can result in a misdiagnosis or a failure to address the root cause of the client's distress, which is a significant ethical lapse. Finally, an approach that uses an outdated or unvalidated instrument introduces a high risk of inaccurate assessment, undermining the integrity of the diagnostic process and potentially harming the client by leading to ineffective or even detrimental treatment. The professional decision-making process for similar situations should involve a systematic evaluation of the client's presenting concerns, a thorough review of their trauma history, and a careful selection of assessment instruments that are evidence-based, validated for the target population, and appropriate for the specific clinical questions being addressed. Clinicians must remain aware of the limitations of any assessment tool and integrate findings with clinical judgment, client self-report, and collateral information when available, always prioritizing the client's well-being and adhering to ethical and regulatory standards. Question 11. Upon reviewing a new client's intake form, which indicates a history of significant trauma, what is the most appropriate initial approach to begin the therapeutic relationship and assessment process, ensuring adherence to trauma-informed care principles? Option A. Make assumptions about their primary trauma triggers based on common presentations and begin exploring those areas to expedite the assessment. Option B. Immediately inquire about the specific details and timeline of their most significant traumatic experiences to gain a comprehensive understanding of their history. Option C. Begin by asking open-ended questions about their current concerns and what they hope to achieve in therapy, allowing them to share at their own pace and guiding the conversation based on their comfort level. Option D. Focus on a structured diagnostic assessment to identify specific trauma-related disorders and develop an immediate treatment plan based on established criteria. The correct answer is C. Begin by asking open-ended questions about their current concerns and what they hope to achieve in therapy, allowing them to share at their own pace and guiding the conversation based on their comfort level. Explanation. Scenario analysis. This scenario presents a common implementation challenge in trauma-informed care, balancing the need for comprehensive client assessment with the potential for re-traumatization. Clinicians must navigate the delicate process of gathering necessary information without overwhelming or further distressing individuals who have experienced trauma. The challenge lies in recognizing that a client's immediate presentation may be a manifestation of their trauma response, and a rigid, directive approach can inadvertently mirror past experiences of control or invalidation. Careful judgment is required to adapt assessment strategies to the client's current capacity and emotional state. Correct approach analysis. The correct approach prioritizes client safety, choice, and collaboration, core tenets of trauma-informed care. By beginning with a non-judgmental, open-ended inquiry about the client's immediate concerns and allowing them to guide the pace and depth of disclosure, the clinician demonstrates respect for their autonomy and builds trust. This approach acknowledges that the client is the expert on their own experience and empowers them to share what they feel ready to share. This aligns with the CCTS framework's emphasis on creating a safe and supportive environment, fostering empowerment, and promoting healing through a client-centered lens. The focus is on building rapport and understanding the client's perspective before delving into specific trauma history, thereby minimizing the risk of re-traumatization. Incorrect approaches analysis. An approach that immediately focuses on a detailed chronological account of traumatic events without first establishing safety and rapport fails to adhere to trauma-informed principles. This can be perceived as intrusive and demanding, potentially triggering a fight, flight, or freeze response in the client, thus re-traumatizing them. Ethically, this disregards the client's right to self-determination and safety. Another incorrect approach involves making assumptions about the client's experiences based on their presenting symptoms without allowing them to articulate their own narrative. This can lead to misinterpretations and a lack of genuine understanding, undermining the collaborative nature of trauma-informed care. It also risks invalidating the client's lived experience, which is a significant ethical breach. Finally, an approach that solely focuses on diagnostic criteria without acknowledging the client's emotional state and need for safety can be detrimental. While diagnosis is a part of clinical practice, it should not overshadow the fundamental need to create a secure therapeutic alliance. This approach neglects the holistic impact of trauma on an individual's well-being. Professional reasoning. Professionals should employ a phased approach to assessment in trauma-informed care. The initial phase should focus on establishing safety, building rapport, and understanding the client's immediate needs and goals. This involves active listening, empathy, and providing opportunities for the client to express themselves at their own pace. Subsequent phases can gradually explore traumatic experiences, always with the client's consent and comfort level as the primary guide. Decision-making should be guided by continuous assessment of the client's effect and readiness, with flexibility to adjust the approach as needed. The CCTS framework emphasizes the importance of a client-centered, empowering, and collaborative process, ensuring that the therapeutic relationship itself becomes a vehicle for healing. Question 12. The assessment process reveals that a client presents with complex trauma symptoms, including dissociative episodes, hypervigilance, and significant interpersonal difficulties stemming from early childhood neglect and subsequent abusive relationships. Which of the following approaches to conceptualizing this client's trauma best aligns with the principles of a certified clinical trauma specialist, CCTS, and current evidence-based practices? Option A. Prioritizing the client's personal narrative above all else, without attempting to integrate it into established psychological theories of trauma. Option B. Integrating insights from neurobiological models of trauma, attachment theory, and information processing theories to create a holistic understanding of the client's experiences and symptoms. Option C. Applying a purely behavioral model to address the client's hypervigilance and dissociative episodes, as these are the most observable symptoms. Option D. Focusing exclusively on a psychodynamic interpretation of the client's early relational dynamics, as this is the primary source of their trauma. The correct answer is B. Integrating insights from neurobiological models of trauma, attachment theory, and information processing theories to create a holistic understanding of the client's experiences and symptoms. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent complexity of trauma and the diverse theoretical frameworks used to understand its impact. A certified clinical trauma specialist, CCTS, must navigate these theories to accurately conceptualize a client's presentation and formulate an effective treatment plan. The challenge lies in selecting the most appropriate theoretical lens, which requires a deep understanding of each theory's core tenets, its applicability to different trauma presentations, and its alignment with evidence-based practices. Misinterpreting or misapplying a theory can lead to ineffective interventions, client harm, and ethical breaches. Correct approach analysis. The correct approach, which aligns with the CCTS certification's emphasis on evidence-based and client-centered care, involves integrating multiple psychological theories of trauma. This is best professional practice because trauma is a multifaceted phenomenon that rarely fits neatly into a single theoretical box. Theories such as the information processing model, explaining how traumatic memories are encoded and retrieved, attachment theory, highlighting the impact of early relational trauma, and neurobiological models, detailing the physiological changes associated with trauma, offer complementary insights. By synthesizing these perspectives, the CCTS can develop a more comprehensive understanding of the client's experiences, their current symptoms, and their relational patterns. This integrated approach allows for a more nuanced and personalized treatment plan, addressing the cognitive, emotional, relational, and physiological dimensions of trauma, thereby maximizing therapeutic efficacy and adhering to ethical principles of providing competent and comprehensive care. Incorrect approaches analysis. Adhering solely to a single, narrowly defined psychological theory of trauma, such as exclusively focusing on a psychodynamic interpretation without considering cognitive or neurobiological factors, represents a significant professional and ethical failure. This approach is overly simplistic and fails to acknowledge the complexity of trauma's impact. It can lead to a superficial understanding of the client's distress, potentially overlooking crucial aspects of their experience and hindering the development of a truly effective treatment plan. This narrow focus may also contravene ethical guidelines that mandate comprehensive assessment and the use of evidence-based practices, which often advocate for an integrative approach. Another incorrect approach is to dismiss or devalue established psychological theories of trauma in favor of anecdotal client narratives without theoretical grounding. While client narratives are vital, they must be understood within a theoretical framework to be clinically meaningful. Without this, the CCTS risks engaging in a form of storytelling therapy that lacks the structure and evidence base required for effective trauma treatment. This can lead to interventions that are not empirically supported, potentially causing harm or prolonging suffering, and failing to meet professional standards of care. Finally, applying a theory of trauma that is not supported by current research or is considered outdated and has been superseded by more robust models would be an ethical failure. This demonstrates a lack of commitment to ongoing professional development and evidence-based practice, which are fundamental to competent trauma care. Such an approach risks employing interventions that are not only ineffective but potentially detrimental to the client's recovery. Professional reasoning. Professionals should adopt a decision-making process that begins with a thorough and comprehensive assessment of the client's presenting issues, history, and strengths. This assessment should then inform the selection of relevant theoretical frameworks. The CCTS should engage in critical thinking, evaluating the strengths and limitations of various theories in relation to the specific client's presentation. This involves staying current with research and best practices in trauma psychology. The decision-making process should be iterative, allowing for adjustments to the theoretical understanding and treatment plan as the therapeutic relationship progresses and more information becomes available. Ethical considerations, including client autonomy, beneficence, and non-maleficence, must guide every step of this process, ensuring that the chosen theoretical approach serves the client's best interests and promotes healing. Question 13. Examination of the data shows a certified clinical trauma specialist, CCTS, is working with a client who identifies as belonging to a specific ethnic minority group with a history of intergenerational trauma and systemic oppression. The client expresses distress related to their trauma, but also references traditional healing practices and community support systems that are integral to their cultural identity. Which of the following approaches best reflects culturally competent trauma care in this context? Option A. Focus solely on universally recognized trauma treatment modalities, assuming that the client's cultural background is secondary to the core trauma processing. Option B. Gently steer the client away from discussing their cultural practices, framing them as potentially hindering objective trauma processing and encouraging a focus on Western psychological frameworks. Option C. Prioritize understanding the client's specific cultural beliefs, values, and practices related to trauma and healing, and integrate these elements into the therapeutic process in collaboration with the client. Option D. Apply generalized interventions based on common trauma symptoms observed in the client's ethnic minority group, without specific inquiry into their individual cultural experiences or preferences. The correct answer is C. Prioritize understanding the client's specific cultural beliefs, values, and practices related to trauma and healing, and integrate these elements into the therapeutic process in collaboration with the client. Explanation. This scenario presents a professional challenge due to the inherent complexity of applying trauma-informed care across diverse cultural backgrounds. The core difficulty lies in recognizing that trauma experiences and their manifestations are not universal. They are deeply shaped by an individual's cultural context, including their beliefs about mental health, family roles, spiritual practices, and historical experiences of oppression or marginalization. A one-size-fits-all approach risks invalidating the client's experience, perpetuating harm, and failing to provide effective support. Careful judgment is required to move beyond superficial cultural awareness to genuine cultural humility and competence. The correct approach represents best professional practice because it prioritizes the client's self-determination and cultural framework. By actively seeking to understand the client's unique cultural lens through which they interpret their trauma and recovery, the clinician demonstrates respect and builds a foundation of trust. This aligns with ethical principles of beneficence and non-maleficence, ensuring that interventions are not only helpful, but also avoid causing further distress or cultural insensitivity. It also adheres to professional guidelines that mandate culturally responsive practice, recognizing that effective trauma treatment necessitates tailoring interventions to the client's specific cultural identity and experiences. This approach fosters a collaborative therapeutic relationship where the client feels seen, heard, and empowered in their healing journey. An incorrect approach that relies on broad generalizations about a cultural group fails to acknowledge individual differences within that group and can lead to stereotyping. This is a significant ethical failure, as it can result in misdiagnosis, inappropriate interventions, and a breakdown of the therapeutic alliance. It violates the principle of respecting client autonomy by imposing external assumptions rather than eliciting the client's own understanding. Another incorrect approach that dismisses the client's cultural beliefs as irrelevant to their trauma response is equally problematic. This demonstrates a lack of cultural humility and can be perceived as ethnocentric, invalidating the client's lived experience and potentially exacerbating feelings of shame or isolation. Such an approach neglects the profound impact culture has on how trauma is understood, processed, and healed, leading to ineffective and potentially harmful treatment. Professional decision-making in such situations should involve a continuous process of self-reflection, ongoing education in cultural competence, and a commitment to client-centered care. Clinicians must actively inquire about the client's cultural background, beliefs, and values, and integrate this understanding into the assessment and treatment planning. This involves asking open-ended questions, listening attentively without judgment, and being willing to learn from the client about their cultural perspective. When faced with uncertainty, the professional decision-making process should involve seeking supervision or consultation with colleagues who have expertise in culturally responsive trauma care. The ultimate goal is to co-create a therapeutic approach that is both clinically sound and culturally congruent for the individual client. Question 14. Performance analysis shows that clients presenting with co-occurring trauma and substance use disorders often exhibit varied responses to initial interventions. Considering the Certified Clinical Trauma Specialist, CCTS, role and ethical obligations, which of the following approaches best optimizes client outcomes and minimizes risk when initiating treatment for such individuals? Option A. Focus solely on addressing the substance use disorder through established addiction treatment protocols, deferring trauma work until sobriety is firmly established. Option B. Conduct a comprehensive assessment of both trauma symptoms and substance use severity, and collaboratively develop a phased treatment plan that prioritizes stabilization and safety before deep trauma processing. Option C. Implement a standardized, predefined treatment protocol for all clients with co-occurring disorders, regardless of individual presentation or readiness. Option D. Immediately initiate intensive trauma processing techniques to address the root causes of the client's distress, assuming substance use is a secondary symptom. The correct answer is B. Conduct a comprehensive assessment of both trauma symptoms and substance use severity, and collaboratively develop a phased treatment plan that prioritizes stabilization and safety before deep trauma processing. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the Certified Clinical Trauma Specialist, CCTS, to navigate the complex interplay between trauma and substance use disorders, a common co-occurrence. The challenge lies in accurately assessing the client's needs, prioritizing interventions, and ensuring that treatment addresses both the trauma and the substance use without exacerbating either. The CCTS must maintain a trauma-informed perspective throughout, recognizing that substance use may be a coping mechanism for unresolved trauma. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, integrated, and trauma-informed assessment. This aligns with CCTS ethical guidelines and best practices, which emphasize understanding the client holistically. By first assessing the severity of both trauma symptoms and substance use, and then developing a collaborative, phased treatment plan, the CCTS ensures that interventions are tailored to the client's readiness and capacity. This approach respects the client's autonomy and promotes engagement by addressing their most pressing needs in a way that minimizes the risk of re-traumatization or relapse. It acknowledges that effective treatment for one condition often necessitates addressing the other concurrently or sequentially, based on the client's presentation. Incorrect approaches analysis. One incorrect approach fails to acknowledge the co-occurrence of trauma and substance use, focusing solely on substance use without a trauma-informed lens. This violates CCTS ethical obligations to provide comprehensive care and can be ineffective or even harmful, as it ignores the underlying trauma driving the substance use. It may lead to client disengagement and treatment failure. Another incorrect approach prioritizes trauma processing before stabilizing substance use. Trauma is central, attempting to process deeply distressing traumatic memories when an individual is actively struggling with substance use can overwhelm their coping mechanisms, leading to increased risk of re-traumatization, dissociation, or relapse. This approach neglects the foundational need for safety and stability, which is a core tenet of trauma-informed care. A third incorrect approach involves imposing a rigid, one-size-fits-all treatment protocol without considering the individual client's unique presentation, readiness for change, or the specific nature of their trauma and substance use. This is ethically unsound as it fails to uphold the principle of individualized care and can be detrimental to client progress and well-being. It disregards the dynamic and often complex relationship between trauma and addiction. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough, integrated assessment of both trauma history and current substance use patterns. This assessment should be conducted within a trauma-informed, client-centered framework, prioritizing safety and building rapport. The next step involves collaborative goal setting with the client, acknowledging their readiness for change. Interventions should then be sequenced and integrated, addressing stabilization of substance use and management of acute distress before delving into deeper trauma processing, if indicated. Ongoing assessment and flexibility in the treatment plan are crucial, recognizing that the relationship between trauma and substance use is dynamic and requires continuous adaptation. Adherence to CCTS ethical codes and best practice guidelines, which mandate comprehensive and individualized care, is paramount. Question 15. The monitoring system demonstrates a client presenting with significant emotional dysregulation, intrusive memories, and avoidance behaviors following a recent car accident. The client reports feeling overwhelmed and experiencing flashbacks related to the accident. Based on this presentation, which of the following classifications of trauma is most directly indicated by the immediate symptoms and the nature of the event? Option A. Vicarious trauma. Option B. Complex trauma. Option C. Chronic trauma. Option D. Acute trauma. The correct answer is D. Acute trauma. Explanation. This scenario presents a professional challenge because accurately differentiating between types of trauma is fundamental to providing effective and ethically sound clinical care. Misclassification can lead to inappropriate treatment modalities, potentially re-traumatizing the client or failing to address the core issues stemming from their experiences. The CCTS certification emphasizes a deep understanding of trauma's impact, requiring clinicians to move beyond surface-level symptom identification to a nuanced appreciation of the etiology and chronicity of traumatic experiences. Careful judgment is required to integrate client self-report, observable behaviors, and theoretical understanding of trauma typologies. The correct approach represents best professional practice because it aligns with the core principles of trauma-informed care and the ethical obligations of a certified clinical trauma specialist. By recognizing the distinct characteristics of acute, chronic, and complex trauma, the clinician can tailor interventions to the specific needs of the client. This includes understanding that acute trauma is typically a single event, chronic trauma involves repeated exposure over time, and complex trauma arises from prolonged, interpersonal victimization, often in developmental stages. This nuanced understanding informs case conceptualization, treatment planning, and the selection of evidence-based therapeutic techniques, ensuring client safety and promoting healing. This approach is ethically mandated by the CCTS framework, which prioritizes client well-being and competent practice through accurate assessment and appropriate intervention. An incorrect approach that focuses solely on the immediate distress without considering the temporal and relational aspects of the trauma would be professionally unacceptable. This failure to differentiate types of trauma represents a significant ethical lapse, as it can lead to a superficial understanding of the client's presentation and the implementation of interventions that are not adequately matched to the underlying trauma structure. For instance, treating a client with complex trauma as if they experienced only acute trauma might overlook the pervasive impact on attachment, self-regulation, and identity, leading to ineffective treatment and potential harm. Another incorrect approach might be to overemphasize a single traumatic event, neglecting the cumulative impact of repeated adverse experiences, which is a hallmark of chronic and complex trauma. This oversight can result in a treatment plan that fails to address the depth of the client's challenges. Ethically, this constitutes a failure to provide competent care, as defined by the CCTS standards, which require a comprehensive understanding of trauma's multifaceted nature. The professional decision-making process for similar situations should involve a systematic assessment that considers the following: the nature of the traumatic event, S, single vs. multiple, duration, interpersonal vs. non-interpersonal, the client's developmental stage at the time of trauma, the impact on attachment and relationships, and the client's current functioning across various domains: emotional, behavioral, cognitive, physiological. Clinicians should utilize validated assessment tools where appropriate, but also rely on their clinical interviewing skills to elicit a detailed trauma history. Case conceptualization should then integrate this information with theoretical models of trauma to arrive at an accurate diagnosis and inform a client-centered, trauma-informed treatment plan. Continuous supervision and consultation are also vital for complex cases. Question 16. Analysis of a certified clinical trauma specialist, CCTS, approach when a client presents with a history of significant trauma, exhibiting symptoms consistent with post-traumatic stress disorder, PTSD, but also reports severe depressive symptoms and significant interpersonal difficulties that appear to be exacerbated by current life stressors. Which of the following assessment and treatment planning strategies best aligns with CCTS ethical guidelines and best practices for trauma-informed care? Option A. Immediately conclude that the client's presentation is too complex for PTSD and suggest referral to a different specialist without further in-depth assessment of the trauma's role. Option B. Focus solely on the most prominent PTSD symptoms, assuming all other distress is a direct consequence of the trauma, and develop a treatment plan primarily targeting these symptoms. Option C. Conduct a comprehensive assessment that explores the trauma history, current symptomology, potential co-occurring conditions, e.g., depression, anxiety, substance use, and the impact of current life stressors, integrating findings into a holistic treatment plan. Option D. Prioritize addressing current life stressors and interpersonal difficulties, deferring a detailed exploration of the trauma history until the client's immediate situational distress has been resolved. The correct answer is C. Conduct a comprehensive assessment that explores the trauma history, current symptomology, potential co-occurring conditions, e.g., depression, anxiety, substance use, and the impact of current life stressors, integrating findings into a holistic treatment plan. Explanation. Scenario analysis. This scenario presents a common challenge in trauma-informed care where a client's presentation of post-traumatic stress disorder, PTSD, symptoms may be influenced by or co-occur with other mental health conditions, or be exacerbated by current life stressors. The professional's responsibility is to accurately assess and differentiate these influences to provide the most effective and ethical treatment, adhering to the CCTS ethical guidelines and scope of practice. Misdiagnosis or an incomplete assessment can lead to ineffective treatment, client harm, and potential ethical violations. Correct approach analysis. The correct approach involves a comprehensive, multifaceted assessment that considers the client's entire clinical picture. This includes exploring the history of trauma, current symptomology, potential co-occurring conditions, such as depression, anxiety disorders, or substance use disorders, and the impact of current life stressors. This approach aligns with best practices in trauma treatment, which emphasize a holistic understanding of the client's experience. It also adheres to CCTS ethical principles of competence, beneficence, and non-maleficence by ensuring that treatment is based on an accurate diagnosis and tailored to the individual's unique needs. This thoroughness is crucial for developing an effective treatment plan that addresses the root causes of distress and promotes recovery. Incorrect approach is analysis. One incorrect approach would be to solely focus on the most prominent symptoms of PTSD without investigating other contributing factors. This could lead to a superficial understanding of the client's distress and a treatment plan that fails to address underlying or co-occurring issues, potentially resulting in treatment resistance or a lack of significant improvement. Ethically, this could be seen as a failure to provide competent care, as it does not meet the standard of a thorough assessment. Another incorrect approach would be to attribute all symptoms directly to the trauma, without considering the possibility of other diagnoses or the impact of current stressors. While trauma is a significant factor, clients may also experience other mental health conditions that require separate or integrated treatment. Ignoring these possibilities can lead to an incomplete treatment plan and may not fully alleviate the client's suffering. This also risks misattributing symptoms, which is a failure of diagnostic accuracy and thus a failure of competence. A third incorrect approach would be to prematurely conclude that the client's symptoms are not related to PTSD and dismiss the trauma history, especially if the presentation is complex or atypical. This could be due to a lack of familiarity with the diverse ways PTSD can manifest or a bias against certain presentations. This would be a significant ethical failure, as it could lead to the client not receiving appropriate trauma-focused treatment, potentially re-traumatizing them through invalidation or neglect. It also demonstrates a lack of professional competence in trauma assessment. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough intake and history-taking, including a detailed trauma history. This should be followed by a comprehensive assessment that utilizes validated diagnostic tools and considers differential diagnoses. Collaboration with other healthcare professionals, if appropriate, can also be beneficial. The process should be client-centered, allowing the client's narrative to guide the assessment while maintaining professional objectivity. Regular reassessment throughout treatment is also vital to ensure the treatment plan remains appropriate and effective. This iterative process ensures that the professional remains competent, ethical, and client-focused. Question 17. Benchmark analysis indicates that a certified clinical trauma specialist, CCTS, is working with a client who has recently disclosed experiencing a significant traumatic event. The client expresses a strong desire to immediately engage in a specific type of somatic experiencing technique they have heard about, believing it will quickly resolve their distress. What is the most ethically and professionally sound initial step for the CCTS to take in response to this client's request? Option A. Conduct a comprehensive impact assessment to understand the client's current presentation, the specific effects of the trauma across various domains, cognitive, emotional, behavioral, physiological, and their readiness for different intervention modalities before discussing or implementing any specific technique. Option B. Explain to the client that while their interest is noted, the CCTS will only proceed with interventions that are part of the established treatment plan, which has not yet been developed. Option C. Immediately implement the requested somatic experiencing technique, as the client's expressed desire indicates their readiness and the potential for rapid symptom relief. Option D. Focus solely on the client's immediate distress and validate their feelings, deferring any discussion of specific interventions until the client is less agitated. The correct answer is A. Conduct a comprehensive impact assessment to understand the client's current presentation, the specific effects of the trauma across various domains, cognitive, emotional, behavioral, physiological, and their readiness for different intervention modalities before discussing or implementing any specific technique. Explanation. This scenario is professionally challenging because it requires the Certified Clinical Trauma Specialist, CCTS, to navigate the complex interplay between a client's immediate distress, their expressed desire for a specific intervention, and the ethical imperative to conduct a thorough impact assessment before implementing any strategy. The CCTS must balance client autonomy with professional responsibility, ensuring that the chosen intervention is not only desired, but also appropriate and beneficial given the client's unique trauma history and current presentation. This requires careful judgment to avoid premature or potentially harmful interventions. The correct approach represents best professional practice because it prioritizes a systematic and evidence-informed process. Conducting a comprehensive impact assessment allows the CCTS to understand the multifaceted effects of the trauma on the client's cognitive, emotional, behavioral, and physiological functioning. This assessment informs the selection of interventions that are tailored to the client's specific needs, strengths, and readiness for change. It aligns with the CCTS Code of Ethics, which emphasizes client well-being, informed consent, and the use of evidence-based practices. By gathering this foundational data, the CCTS can ensure that the chosen intervention is not only responsive to the client's request, but also ethically sound and likely to yield positive outcomes, thereby minimizing the risk of iatrogenic harm. An incorrect approach that immediately implements the client's requested intervention without a prior impact assessment represents a significant regulatory and ethical failure. This bypasses the professional obligation to thoroughly evaluate the client's needs and the potential impact of the intervention. It could lead to an intervention that is not suitable for the client's current state, potentially exacerbating symptoms or creating new difficulties. Ethically, it violates the principle of beneficence, doing good, and non-maleficence, avoiding harm, by not ensuring the intervention is appropriate. It also undermines the principle of informed consent, as the client may not fully understand the implications or suitability of the intervention without a proper assessment. Another incorrect approach, focusing solely on the client's stated desire without considering the broader impact of trauma, fails to acknowledge the complex nature of trauma recovery. Trauma often affects multiple domains of a person's life, and addressing only one symptom or expressed need may be insufficient or even counterproductive if underlying issues are not understood. This approach risks superficial treatment and neglects the CCTS duty to provide comprehensive care. A third incorrect approach, delaying intervention indefinitely due to an overly prolonged or complex assessment process, can also be problematic. While thoroughness is important, an assessment that becomes a barrier to necessary support can be detrimental to the client's progress and well-being. This can lead to client frustration and a breakdown in the therapeutic alliance, and may also be seen as a failure to provide timely and effective care. Professionals should employ a decision-making framework that begins with a thorough, yet efficient, impact assessment. This assessment should guide the selection of interventions, always in collaboration with the client. The process involves 1. Establishing rapport and a safe therapeutic environment. 2. Conducting a comprehensive assessment of trauma's impact across various domains. 3. Collaboratively discussing assessment findings with the client. 4. Exploring and recommending evidence-based intervention strategies that align with the assessment and client goals. And 5. Continuously monitoring the client's response to interventions, adjusting as needed. This iterative process ensures that interventions are both client-centered and professionally responsible. Question 18. The audit findings indicate a need to review the diagnostic and treatment approaches for clients presenting with significant anxiety symptoms and a history of traumatic experiences. Which of the following approaches best aligns with the Certified Clinical Trauma Specialist, CCTS, regulatory framework and ethical guidelines when assessing and managing such cases? Option A. Focus exclusively on symptom reduction of anxiety through immediate coping skills training, deferring any discussion or assessment of past traumatic experiences until the anxiety symptoms are fully resolved. Option B. Immediately implement generalized anxiety disorder treatment interventions based on the client's self-reported anxiety levels, without further investigation into their trauma history or potential trauma-related symptomology. Option C. Conduct a thorough trauma-informed assessment to explore the nature and impact of past traumatic events, followed by a differential diagnosis that considers both primary anxiety disorders and trauma and stress-related disorders, leading to an integrated treatment plan. Option D. Prioritize the diagnosis and treatment of a primary anxiety disorder, assuming that anxiety symptoms are independent of any reported trauma history, and apply standard anxiety treatment protocols. The correct answer is C. Conduct a thorough trauma-informed assessment to explore the nature and impact of past traumatic events, followed by a differential diagnosis that considers both primary anxiety disorders and trauma and stress-related disorders, leading to an integrated treatment plan. Explanation. This scenario presents a professional challenge because it requires the Certified Clinical Trauma Specialist, CCTS, to navigate the complexities of diagnosing and treating co-occurring trauma and anxiety disorders within the strict confines of the CCTS regulatory framework. The challenge lies in differentiating primary anxiety disorders from trauma-related anxiety symptoms, ensuring accurate assessment, and implementing evidence-based interventions that are ethically sound and compliant with CCTS standards. Careful judgment is required to avoid misdiagnosis, inappropriate treatment, and potential harm to the client. The correct approach represents best professional practice because it prioritizes a comprehensive, trauma-informed assessment that explicitly considers the client's trauma history as a potential etiological factor for their anxiety symptoms. This aligns with the CCTS mandate to provide specialized trauma care. By integrating assessment of trauma exposure, symptom presentation, and functional impairment, and by utilizing a differential diagnostic process that accounts for trauma-related disorders like PTSD and acute stress disorder, the specialist ensures that the treatment plan is tailored to the root causes of the client's distress. This approach is ethically sound as it promotes client well-being and adheres to the principle of do no harm by avoiding premature or inaccurate conclusions. It also reflects professional competence by demonstrating an understanding of the intricate relationship between trauma and anxiety. An incorrect approach that focuses solely on a primary anxiety disorder without thoroughly exploring the trauma history would be a significant regulatory and ethical failure. This would violate the CCTS scope of practice by neglecting the core competency of trauma assessment and intervention. Ethically, it could lead to ineffective treatment, prolonged suffering for the client, and a failure to meet the client's specific needs, potentially constituting a breach of professional duty. Another incorrect approach that involves immediate application of generalized anxiety treatment protocols without a trauma-informed lens risks exacerbating trauma-related symptoms or overlooking the underlying trauma, which is a direct contravention of CCTS ethical guidelines and best practices for trauma-informed care. A third incorrect approach that relies on self-report alone without incorporating objective assessment tools or collateral information, where appropriate and consented to, would be a failure to conduct a thorough and evidence-based assessment, a cornerstone of ethical and competent practice within the CCTS framework. The professional decision-making process for similar situations should involve a systematic, multifaceted approach. First, always begin with a comprehensive trauma-informed assessment, actively seeking to understand the client's history of traumatic experiences and their impact. Second, engage in a differential diagnostic process, considering both primary anxiety disorders and trauma and stress-related disorders. Third, utilize evidence-based assessment tools and techniques appropriate for trauma and anxiety. Fourth, develop a treatment plan that is individualized, evidence-based, and directly addresses the identified trauma and anxiety components, with ongoing monitoring and adjustment. Finally, consult with supervisors or peers when facing complex cases to ensure adherence to ethical and regulatory standards. Question 19. Research into the impact of early caregiver relationships on adult trauma survivors reveals a strong correlation between insecure attachment styles and heightened vulnerability to complex trauma symptoms. A certified clinical trauma specialist, CCTS, is working with a client who presents with significant difficulties in interpersonal relationships, chronic feelings of emptiness, and a history of repeated traumatic experiences. Client's early life was characterized by inconsistent and emotionally unavailable caregivers. Considering the CCTS framework, which of the following best guides the clinician's approach to integrating this understanding of attachment into treatment? Option A. Prioritize building a secure and predictable therapeutic relationship, using it as a foundation to explore and process the client's trauma and attachment-related challenges in a phased and client-led manner. Option B. Minimize discussion of early life experiences, including attachment, to avoid re-traumatizing the client and concentrate solely on present-day coping skills. Option C. Directly challenge the client's insecure attachment patterns by encouraging immediate engagement in highly independent and self-reliant behaviors to foster resilience. Option D. Focus exclusively on processing the specific traumatic memories, as attachment issues are secondary and will resolve once the primary trauma is addressed. The correct answer is A. Prioritize building a secure and predictable therapeutic relationship, using it as a foundation to explore and process the client's trauma and attachment-related challenges in a phased and client-led manner. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the clinician to navigate the complex interplay between a client's early attachment experiences and their current trauma responses, while adhering strictly to the ethical and regulatory standards of the Certified Clinical Trauma Specialist, CCTS, framework. The clinician must recognize that attachment patterns are not merely theoretical constructs, but have profound, measurable impacts on an individual's capacity for emotional regulation, interpersonal relationships, and their overall response to traumatic events. Misinterpreting or oversimplifying this relationship can lead to ineffective or even harmful interventions. Correct approach analysis. The correct approach recognizes that a client's insecure attachment style, developed in early life, significantly shapes their perception of safety, their ability to form trusting therapeutic alliances, and their patterns of re-experiencing trauma symptoms. Understanding this foundational aspect allows the clinician to tailor interventions that address both the trauma itself and the underlying attachment wounds. This approach aligns with CCTS principles by emphasizing a holistic, client-centered perspective that acknowledges the developmental origins of trauma responses. It promotes building a secure base within the therapeutic relationship, which is crucial for processing traumatic memories and fostering resilience, thereby adhering to ethical guidelines that prioritize client well-being and evidence-based practice. Incorrect approach is analysis. One incorrect approach might focus solely on the immediate trauma symptoms without exploring the client's relational history. This fails to address the root causes of their difficulty in forming secure attachments, which often exacerbate trauma responses. Ethically, this could be seen as providing incomplete care, not fully addressing the client's needs as dictated by a comprehensive understanding of trauma, which includes attachment. Another incorrect approach might involve directly attempting to fix the attachment style without first establishing safety and processing the trauma. This can be re-traumatizing for the client, as it may involve confronting early relational deficits before they have the coping mechanisms to do so. This violates the CCTS principle of do no harm and disregards the sequential nature of trauma treatment, which prioritizes stabilization and safety. A third incorrect approach could be to dismiss the client's attachment history as irrelevant to their trauma response, attributing all difficulties solely to the traumatic event. This demonstrates a lack of understanding of the integrated nature of trauma and development, and it limits the clinician's ability to provide effective, nuanced treatment. This approach fails to meet the professional standard of comprehensive trauma assessment and intervention. Professional reasoning. Professionals should approach such situations by first conducting a thorough assessment that integrates both trauma history and attachment patterns. They should then prioritize establishing a secure and trusting therapeutic alliance, recognizing that this relationship itself can serve as a corrective attachment experience. Intervention should be phased, addressing immediate safety and stabilization before delving into deeper attachment work, always with the client's readiness and capacity in mind. This decision-making process is guided by the CCTS ethical code, which mandates competence, client welfare, and the application of evidence-informed practices that consider the multifaceted nature of trauma. Question 20. The performance metrics show a significant increase in clients presenting with acute distress and suicidal ideation during evening hours, requiring immediate intervention. As a certified clinical trauma specialist, CCTS, what is the most appropriate initial approach to manage these crisis situations effectively and ethically? Option A. Focus exclusively on contacting emergency services and ensuring the client's physical safety without engaging in any emotional support or assessment of their internal state. Option B. Immediately initiate detailed exploration of the client's past traumatic experiences to understand the root cause of their current distress. Option C. Advise the client to wait until regular business hours to speak with a specialist who can conduct a comprehensive assessment. Option D. Implement trauma-informed de-escalation and stabilization techniques, focusing on immediate safety, emotional regulation, and resource identification, before proceeding to more in-depth trauma processing. The correct answer is D. Implement trauma-informed de-escalation and stabilization techniques, focusing on immediate safety, emotional regulation, and resource identification, before proceeding to more in-depth trauma processing. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified clinical trauma specialist, CCTS, to balance immediate crisis intervention needs with the long-term implications of a client's trauma history, all while adhering to strict ethical and regulatory guidelines. The urgency of a crisis can sometimes lead to a focus solely on immediate safety, potentially overlooking crucial diagnostic information or the client's capacity for engagement in more complex interventions. The CCTS must navigate the client's acute distress, potential for re-traumatization, and the need for a structured, evidence-based approach within the defined scope of practice. Correct approach analysis. The correct approach prioritizes a rapid, yet thorough assessment of immediate safety and risk, followed by the implementation of de-escalation and stabilization techniques. This aligns with the core principles of crisis intervention, which emphasize reducing immediate threat, providing emotional support, and restoring a sense of control. For a CCTS, this means utilizing trauma-informed de-escalation strategies that acknowledge the client's experience without re-traumatizing them, and focusing on grounding techniques and resource identification. This approach is ethically sound as it prioritizes client safety and well-being, and it is regulatory compliant by adhering to best practices in trauma-informed care and crisis management, as outlined by professional bodies governing CCTS practice. Incorrect approaches analysis. One incorrect approach might involve immediately launching into detailed trauma processing without adequately assessing immediate safety or stabilizing the client. This is ethically problematic as it risks re-traumatizing the client and can exacerbate their distress, violating the principle of do no harm. It also fails to meet the immediate needs of a crisis situation, potentially leading to further harm or disengagement from services. From a regulatory standpoint, this could be seen as a failure to adhere to established crisis intervention protocols. Another incorrect approach could be to solely focus on external safety measures without addressing the client's internal emotional state or providing any form of psychological support. While safety is paramount, a crisis often involves significant emotional dysregulation. Ignoring this aspect neglects the holistic needs of the client and fails to provide the necessary support to help them regain equilibrium. This approach is ethically deficient as it is not client-centered and may be seen as a failure to provide adequate care within the scope of a CCTS. A third incorrect approach might be to defer all crisis management to other professionals without offering any immediate support or assessment, even if the situation is within the CCTS purview. This could be considered a failure to act in a timely manner when a client is in distress, potentially leaving the client vulnerable. Ethically, it could be a breach of professional responsibility if the CCTS possesses the skills to offer initial support and stabilization. Professional reasoning. Professionals should employ a decision-making framework that begins with a rapid risk assessment, prioritizing immediate safety. This is followed by de-escalation and stabilization techniques, tailored to the client's trauma history and current presentation. The CCTS should then collaboratively develop a plan that addresses immediate needs and outlines steps for further support, always operating within their scope of practice and adhering to ethical guidelines and relevant regulations. This iterative process ensures that the client's immediate safety is secured while laying the groundwork for more in-depth therapeutic work.